School administrators tell us that hearing loss is one of the biggest issues for kids in developmental age. There's really several different issues, but I think the main one is the ability to purchase hearing devices. I'm a state representative representing the 34th district, which includes Lenawee County. There's about 400 kids born a year in Michigan that has some type of hearing loss. There's 2,700 kids in our school systems with the same hearing loss, and their ability to hear is connected to their development in their young life. House Bill 4944 provides coverage for hearing devices for the treatment of hearing loss. It provides hearing service and devices up to the age of 19. It also provides for coverage of $3,000 per hearing aid every 3 years. House Bill 4963 provides coverage for hearing-related services such as audiological examinations, hearing aid evaluations, maintenance or repairs, speech-language pathology, all the things that a person needs to have done while they're in the process of obtaining hearing devices and after.
My name is Melissa Bainan. I'm the director of the Deaf and Hard of Hearing program in Trenton. So I've been doing this for about 20 years. And over the years, I've worked with children that have been amplified at all stages of their life. And when we think of children that are born with hearing loss, I want to say it's over 80%, maybe even over 90% of children that are born with hearing loss are born to parents with hearing. They're in a situation that's foreign and unfamiliar, and there's all these different options, right? When it's hearing loss, there's communication options, there's amplification options. So I think as they're trying to navigate all of that, then you have this incredibly large financial burden. So in my experience, kids that didn't have proper amplification or weren't amplified early or couldn't keep up with the technology, it was 100% a financial burden. Some of these families just can't afford it, and there aren't a ton of resources to help them. And again, they're navigating so many other things that it's a difficult juggle per se for them.
I am Dr. Samantha Castellut. I am an educational audiologist here for Trenton Public Schools. I also have had hearing loss my whole life, so I have a lot of experience wearing hearing aids. The majority of my life I use those. A lot of times insurance has very limited coverage for hearing aids, or just a lack of coverage from insurance providers. Financially, hearing aids are very expensive. It's been a long time since I sold a pair of hearing aids, but I know they were, top level was like maybe $6,000 a pair. But that's a huge financial burden for families. It's scary to think about. You're going to have to replace those multiple times over the course of, 18 years. So if the financial burden of hearing aids was, sort of lessened for families, I think that would result in more children having better quality hearing aids, more continuity of auditory exposure, which would help their language development. And reading skills and all of that are tied to language development. So it could really boost the educational outcomes for those kids with hearing loss who have, maybe intermittent access to hearing aids. Maybe they have them at school, but they don't have them at home. There's so much language exposure at home that if a child doesn't have hearing aids or anything to access that information at home, then they're really, really missing out on a lot of incidental learning, a lot of social pragmatic learning. Almost all of that occurs in the home. So if those kids don't have hearing aids to access all the language that happens in the home, they're really missing out on a lot of learning opportunities and a lot of just foundational means of language and communication.
My name is Teresa Sundberg, and I am an early on teacher here in Trenton. We specialize in working with newly diagnosed deaf and hard of hearing infants and toddlers. When a child is first diagnosed with a hearing loss, it's very important that they get hearing aids as soon as possible because you want that baby to have access to sound and speech at a conversational level so they don't get behind in their speech and language development. Well, many families do qualify for Medicaid, but a lot of parents don't qualify for Medicaid based on their income. At that point, they look at their own personal, health insurance, and they look to see if they have coverage for hearing aids, and oftentimes they don't. And so they end up having to pay out of pocket for those hearing aids, and not just the hearing aids, but the appointments with the audiologists, the appointments to have the ear molds made, and then you pay for the ear molds. Babies' ears grow quite frequently, so you're talking in the first year, if they get hearing aids at a month, they could get possibly 3 to 4 sets of ear molds that they also have to pay for. So it is an extra, a big cost to families when they have to purchase hearing aids.
My name is Stephanie Pennington, and my son is Ryder, and he has hearing loss, and he wears hearing aids. He's 11 years old. I can tell you I've had to cancel appointments because of cost. I've had to not get molds after he had grown out of them, and some of them deteriorated for a few months because of cost. And then, what do you send your child to school to try to learn with no hearing aids that fit appropriately or that are broken? It puts a huge impact on their everyday life.
If that family wants listening and spoken language, the hearing aids are definitely the first step for that. Access, to communication and developing spoken language, and just communication and opportunities to interact with the majority of the population who is hearing. Giving our kids hearing aids, it really helps them to, follow along with their peers. And then we have, hearing assistive technology as well. So using microphones in group settings or something like that really allows our kids to be more included, be more connected, not necessarily be as isolated or sort of left in the dark about things.
If this bill can ease their pocketbook, during this very stressful time, things are already expensive. So, a doctor tells you that your child needs hearing aids, and then you find out the cost, and it can be just a very stressful thing. When my child was born, and I did find out that he was profoundly deaf, I knew what was possible because I was a teacher, but I also knew that there was a process, and the first process and the first step was getting hearing aids. I just remember my husband and I couldn't believe that our own, insurance, and we had Blue Cross, Blue Shield, and I was a teacher, I thought we had really good insurance. Hearing aid coverage was not part of it.
Talk to your representatives, your senators, and make sure that they understand how important this is to our kids of Michigan. That this will give all of our children the opportunity to learn, to comprehend, and to develop in those young ages.
So, as a whole, it's a very small price to pay for such a big impact when it comes to our kids. And there needs to be some equity for all of our kids. It's a medical necessity. It doesn't seem like something we should be even debating. They need it so they could hear, so that they can communicate in whatever mode is chosen for them, and they can live a fulfilled life.